name's Tiffany. I am in the bachelor's program, and part of that is we have to do a teaching project. And so I chose to teach nursing students due to the fact that most of you guys right now are learning about like how to take care of like diseases that are in front of you, trying to learn the basics, like you take care of what you can see. But a lot of your nursing, once you get out of school and into the workplace, is not necessarily taking care of just what you see in front of you, but preventative care plays a huge role in that. And with healthcare changing, there's lots of goals to make preventative care is pushed. Like if you look at Healthy People 2020, a lot of it is preventing diseases like stop smoking type things, screenings and such as that. So I'm going to go over some preventative care and the risk factors for colon cancer, because colon cancer is one of the most common cancers, but it's one of the most preventable types of cancer with appropriate screening. So as a nurse, you'll see people that fall into the categories that should be screened, that there's red flags for screening, and it's your job, along with the doctor and the other professionals, to kind of push and teach and let these people know that you can, prevent these types of things. So we're going to talk about get your rear in gear. So the first thing is basically an overview of your colon. So this is what your colon looks like, but not as pretty. There's also a poster here that has the colon. So the main part that you focus on with colon cancer is the large bowel. So anywhere from the rectum to the cecum. And that's what gets screened and checked for colon cancer. So a couple facts to know: colon cancer equally affects both men and women, all ethnic groups, racial backgrounds. It's the third most common type of cancer on both sides, women and men. It falls number 3 in there. But it's the second leading cause of death in both sexes. Some risk factors for colon cancer are age, heredity, your family, that stuff follows you, you can't escape. Diets that are high in fat, low in fiber, smoking, excessive alcohol use, lack of exercise, and obesity. So symptoms, typically in colon cancer, there's no symptoms in the beginning. You don't have anything that leads you to say something's wrong until it's pretty advanced. Changes in bowel habits, diarrhea, constipation, those sorts of things are kind of you relate to stress or different things like that. What did I eat? So they're not huge pushers to make people go and get checked out right away. Incomplete bowel movements, meaning they go to the restroom, but when they're done, it feels like they still have to go. They never feel like it's finished. Changing in the shape and the size of stool, like it may come to like a more ribbon shape or something because it's going past like a tumor or cancer, so it's forming to go around that in order to go to the restroom. And then of course rectal bleeding and blood in your stool. So how can you get screened? There's a couple of screening options. One of them is a very simple way. It's called a fecal occult blood test. It is one of these. Basically the patient has a sample of stool. They put them on this little card, and then they mail this card in, or if they're in the doctor's office, they can give you this card. You put a little spot of something that just tests for it, whether it's positive or negative. Put it in, and depending on the color that it turns, it would be positive for blood. Problem with this is it's positive for blood, but you don't know why. Like, where's the blood coming from? Do they have an ulcer and it's bleeding? Do they have a hemorrhoid? So it's not a real reliable type of test. There is a test called the Cologuard test, which is a new test that came out, and it does do similar. You do the stool, but it also has elements in it that can check for like genetic type things exposed to it, and it checks on that rate. So it's a lot more reliable than just a regular stool test. The main checks for colonoscopies or for colon cancer would be colonoscopy and a flexible sigmoidoscopy. A flexible sigmoidoscopy is a very short version of a colonoscopy, so it's really kind of pointless to check just part. Like, you want to go ahead and do the whole thing. So what happens during a colonoscopy, patients, this is their big thing on why they don't want to get screened. Colonoscopies are not, people think they're horrible, but they're not. So the day before colonoscopy, they will have to do a bowel, they'll have to fast. Nothing but clear liquids. They will get a bowel kit, something similar to this. Inside will be bottles that they will mix to drink poison, basically. And they're going to go to the restroom like all night long and get cleaned out. Miralax is also commonly used. It's a little better tasting, and most people prefer this versus seeing this. So they will prep all night. They will come, and then we will put them to sleep, and then a long scope with a camera on the end will go through the entire large bowel, checking for any kind of polyps or lesions. So polyps, what are polyps? Polyps are basically, they're not all bad. Some polyps are fine and would never turn into anything bad. Other polyps are just things that if you have not been checked, then they would eventually turn to cancer over a certain amount of years. So like on the end, that would be considered a hyperplastic polyp. It doesn't even really look scary. It's like the same color as the rest of the mucosa. Those are okay. We still do take them off and test them unless there's like a gazillion, then we choose a few. And then it goes down all the way to adenomas, which if you left this in, it would eventually create a colon cancer. So I also have here, if she wants to step up, kind of like an idea of what polyps and how this works during a colonoscopy. So this is her colon. These little tiny polyps here would be the hyperplastic polyps. They don't look scary, they're nothing bad. These are more the adenomatous polyps that we need to take away and get those off. This would be where it's actually turning to cancer. So you take those off in a couple of different ways. The hyperplastic polyps, the small little ones, and that's why early screenings are easy and simple. All you do is take some biopsy forceps and you just pluck them off, and that's it. Simple, easy, clean, it's off. With the larger adenomatous polyps, you would have to take a snare, which is a little more involved and a little more risk to patients because of bleeding and that sort of thing. And a lot of patients are elderly with blood thinners and things like that, so you would really rather get these when they're little. So those larger polyps would take something which is called a snare, and it will be hooked to electricity and cautery so the doctor can burn and cut. And depending on the size, your snare would come out and it would wrap around the polyp. The doctor would cut and you would get rid of that polyp. Sometimes polyps are still polyps, but they're too large to actually take safely either other way. So you can do some other stuff, like you can have that polyp cut out and your colon resected or something like that. But all of these things can pretty much kind of go away with proper screening. So here's just a quick look at colon cancer. If you look, like there's stage 1, it's still just sitting in there. It would be like the adenomatous polyps kind of grown into something, but it hasn't advanced into the wall. Stage 2, a little bit worse, and by stage 3,